Hilary at Riverside Counselling, which sounds the most amazing charity organisation.
We started in 1989 from the Friends Meeting House in Henley, just a group of women who decided that the community could do with some professional mental health support, and we've grown massively since then. So our aim is to support mental health by providing really high quality, effective, accessible and affordable counselling. And so we currently have 52 counsellors now across the county. We're based normally, when things are up and running, in Henley, Wallingford, Didcot and Berensfield. And we work from 16 different locations within those towns. So we really have the policy that embedding yourself into the community is really important, to be able to understand the community and to understand the needs of that community. And we're very keen to adapt to the needs. So we haven't got a sort of prescriptive offering. We just basically hear what the community is saying and try and adapt to their needs. Last year, we offered 4,500 counselling sessions to individuals, but we've also expanded what we do to offer group work. So we run a therapeutic group. We offer parent work, which we found really beneficial when we're working with young people, supporting the parents to understand what's going on for their adolescent. We run parenting courses. We run groups in Berensfield, particularly for young mums who are struggling to find their feet. And we've offered ADHD groups in Henley and bereavement support. So we're basically sort of meeting whatever need the community has. I mean, we feel strongly that counselling has a ripple effect. I think sometimes people feel that, you know, working on a one-to-one basis with an individual is sort of a long process, that actually, you know, where does it get a community? But actually it's fundamental, we find, in making a community strong. And I think definitely we're seeing the effect on the whole community by being present as an organisation. We were really fortunate, I think, as a service in seeing this coming slightly before lockdown actually happened. So in the weeks before we started putting the idea into the minds of the clients that we'd have to work online or by phone, so that when lockdown actually happened, 92% of our clients transferred to working online and all our counsellors working from home.
So OCF gave you a grant at the beginning.
The funding particularly has supported us being able to transition to taking new clients into the service, because we had to do online training for all the counsellors. They had to be proficient to meet our ethical body's requirements, because we belong to the British Association of Counselling and Psychotherapy. Mm-hmm. So we have to meet their requirements. So we all had to transition and learn and train. And also it's a different experience working online. So we had to make sure that clients would be safe and that the risk factor was low. Mm-hmm. So what it's enabled us to do is to be able to offer initial consultations. And we've done that for 59 clients so far. We've actually had 80 referrals. So lockdown is easing, our figures are just going up, rocketing, really. Mm-hmm. As an affordable service, our clients all do pay something. It might be as little as £2. Mm-hmm. Clients who can afford to pay, we charge a sort of higher rate, but it's based on income. So as incomes have dropped, we've dropped the fee that clients are paying.
Your clients, have some embraced the one-to-one online experience? Do you think for some people it sort of, they prefer it like that?
Well, I think you're right in there's a mixed response. Some clients find it difficult to find a space in their home that's private and confidential. Other clients have really embraced it, and it's enabled us to sort of spread our wings a bit further, really, and to be able to, you know, see people who wouldn't be able to get into a building. They can't attend a session face to face. So we really feel that we'd like to be able to carry on offering it as part of our service. We work with young people from the age of 12, and interestingly the referrals from young people was very slow and almost dropped off completely at the start, but now again as schools begin to open and I think families are sort of, there's slight normality, they're socialising again and they're struggling with social anxiety. I think the numbers have gone up again. So we have young people, I think our eldest client at the moment is 86, but we do have really good relationships with CAMS, the Child and Adolescent Mental Health Services, and they have contacted us, and we've had contact with Talking Space, which is the NHS service for adults as well, thinking together how we could, you know, work more closely and manage referrals. We've had lots of contact with GPs, and we've kept them informed of what services we're offering. I mean, we did have a drop-in service based in Berensfield, but now we've decided to make that available to young people. So we've got a designated young people's phone line, and we've got an adult phone line, so that people can call in and have a 20-minute just sort of, you know, catch up chat, and just a sort of touching base, and also to think with them about whether ongoing counselling would be helpful. So that's something new that we've started. Everything we do is clinically led, so we wouldn't ever cut short somebody's therapy if we felt clinically it was the right thing to continue. So that's our sort of philosophy. We try and bridge a gap between NHS provision, which is free and short, and private provision, which is out of the, you know, reaches of most individuals that we work with. We've connected up with the Henley Good Neighbours organisation, but I agree, I think there's something being quite powerful about what's happened, and communities coming together and connecting up in that way, and I think there will be opportunities going forward to do more of that. One of the things that we had from OCF was an amazing amount of funding to set up a new website, and also to enable us to have a digital system. So we're hoping that all of that will help us connect up more. I mean, certainly the website, one of the things that we've done is increase our social media. So we now have Instagram and Facebook, and people are coming to us because of that. The drop-in is in part about signposting. So we're hoping that we'll be able to sort of, some people who maybe don't need counselling but could do with a good neighbour, you know, we're connecting up in that way. So we're hoping to be able to develop that more through our website and through this drop-in service.
I think your website's wonderful. I got on it and I thought, wow.
We're very pleased that OCF made that possible for us.
Hilary, about online sessions and whether you think you'll carry them on post-lockdown.
As I was saying to Amanda, some clients really do get a lot of benefit from them, and they can't access our services because, like Sue says, you know, lots of rural communities around here, and they can't get to where we work, even though we work in a variety of locations. So yes, I definitely hope that we will be able to continue. It does mean that we'll have to undergo further training, or at least some of the counsellors will, but yes, we'd like to offer it ongoing.